In this channel we offers you a deep dive into the world of medicine and healthcare, where insightful perspectives, medical updates, and expert insights are shares. Join the journey to gain a better understanding of various health topics and stay informed with the latest medical breakthroughs. Today we will have a discussion on leg ulcers, which are a prevalent and debilitating medical condition characterized by open sores or wounds on the lower extremities, particularly the legs. These ulcers often result from various underlying health issues and can significantly impact a person's quality of life. Understanding the causes, types, risk factors, and management of leg ulcers is crucial for both healthcare professionals and individuals affected by this condition. 1. Introduction. Leg ulcers pose a significant health concern globally, affecting individuals of all ages. These wounds typically occur below the knee and can persist for weeks, months, or even years, leading to chronic complications. The primary cause of leg ulcers is impaired blood circulation, commonly associated with venous insufficiency, arterial disease, or a combination of both. In this comprehensive discussion, we will delve into the various aspects of leg ulcers, including their causes, types, risk factors, and management strategies. 2. Causes of leg ulcers. A. Venous insufficiency. Venous ulcers account for a majority of leg ulcers and are often the result of chronic venous insufficiency. In this condition, damaged valves in the veins impede blood flow back to the heart, leading to increased pressure in the veins. Over time, this elevated pressure causes the skin to break down, forming ulcers. B. Arterial disease. Arterial ulcers, less common than venous ulcers, are caused by inadequate blood supply to the lower extremities. Peripheral arterial disease and atherosclerosis can restrict blood flow, depriving tissues of oxygen and nutrients, thereby predisposing the affected area to ulceration. C. Other causes. Other contributing factors to leg ulcers include diabetes, which can lead to neuropathy and poor wound healing, and autoimmune conditions like vasculitis. Trauma, infections, and certain medications may also play a role in ulcer development. 3. Types of leg ulcers. A. Venous ulcers. Venous ulcers typically manifest on the medial or lateral aspects of the lower leg. They are characterized by irregular borders, a shallow appearance, and may be accompanied by edema and varicose veins. B. Arterial ulcers. Arterial ulcers often occur on the toes, heels, or bony prominences due to reduced blood supply. These ulcers tend to be deep, with well-defined edges and minimal exudate. C. Neuropathic ulcers. In individuals with diabetes, neuropathic ulcers can develop as a result of reduced sensation and poor wound healing. They are commonly found on pressure points, such as the sole of the foot. 4. Risk factors. Several factors increase the risk of developing leg ulcers. A. Age. Advancing age is a significant risk factor, as the incidence of circulatory disorders tends to increase with age. B. Gender. Women are more prone to venous ulcers, often due to hormonal influences and pregnancy-related changes in venous pressure. C. Obesity. Excess body weight can contribute to venous insufficiency and arterial disease, increasing the likelihood of leg ulcers. D. Smoking. Tobacco use exacerbates vascular issues, impairing blood flow and hindering the healing of ulcers. 5. Management of leg ulcers. A. Wound care. Proper wound care is essential for managing leg ulcers. This includes cleaning the wound, removing necrotic tissue, and applying dressings to promote healing. B. Compression therapy. For venous ulcers, compression therapy is a cornerstone in managing edema and improving venous blood flow. Various compression bandages and stockings are available for this purpose. C. Revascularization. In cases of arterial ulcers, revascularization procedures, such as angioplasty or bypass surgery, may be necessary to restore adequate blood flow. D. Diabetes management. For individuals with diabetes, optimal glycemic control is crucial to prevent and manage neuropathic ulcers. Regular foot examinations are also recommended. E. Lifestyle modifications. Encouraging lifestyle changes, including weight management, smoking cessation, and regular exercise, can play a significant role in preventing and managing leg ulcers. 6. Conclusion. Leg ulcers represent a complex medical condition with various underlying causes and risk factors. Addressing these ulcers requires a multidisciplinary approach, involving healthcare professionals from different specialties. Timely and appropriate management is crucial to prevent complications and enhance the quality of life for individuals affected by leg ulcers. As research and technology continue to advance, there is hope for improved therapeutic interventions and a better understanding of the mechanisms underlying this challenging condition. Let's have a discussion of a 65-years-old female with type 2 diabetes diagnosed 15 years ago. Hypertension controlled with medication. Hyperlipidemia managed with statins. Previous history of smoking, quit 10 years ago. Presenting complaint. She presents with non-healing ulcers on her lower extremities, particularly the lower legs. She reports persistent pain and discomfort in the affected areas, limiting her mobility. Onset and progression. The leg ulcers first appeared approximately 6 months ago. Initially, they were small wounds that gradually increased in size. She tried over-the-counter topical treatments without improvement. She also noticed a gradual discoloration of the skin around the ulcers. Pain and symptoms. She describes the pain as a constant throbbing sensation in her legs, exacerbated when standing or walking. She reports occasional itching and tenderness around the ulcers. She denies any recent trauma or injury to the affected areas. Diabetes management. Her diabetes has been relatively well managed with oral hypoglycemic agents. However, she admits occasional lapses in dietary control. Recent glycated hemoglobin levels indicate fluctuating glucose control. Vascular assessment. Peripheral vascular examination reveals diminished pedal pulses in both feet. Ankle brachial index is below normal, suggesting peripheral arterial disease. Doppler ultrasound confirms the presence of arterial stenosis in the lower extremities. Wound characteristics. The ulcers are located on the medial aspect of both lower legs. They exhibit signs of infection, including erythema and purulent discharge. Tissue surrounding the ulcers appears edematous, and there are indications of venous insufficiency. Differential diagnosis. 1. Diabetic foot ulcers. 2. Peripheral arterial disease. 3. Venous insufficiency ulcers. 4. Mixed arterial venous ulcers. Diagnostic tests. 1. Comprehensive blood work, including complete blood count and inflammatory markers. 2. Doppler ultrasound for vascular assessment. 3. Wound cultures to identify infectious agents. 4. Imaging studies, X-ray, magnetic resonance imaging, to assess the extent of tissue involvement. Treatment plan. 1. Glycemic control optimization through medication adjustment and dietary counseling. 2. Vascular intervention to address arterial stenosis, by angioplasty or bypass surgery. 3. Topical and systemic antibiotics for wound infection. 4. Compression therapy for venous insufficiency. 5. Pain management and wound care education. Follow-up. Regular monitoring of wound healing progress, glycemic control, and vascular status. Collaborative care involving endocrinologists, vascular surgeons, and wound care specialists to optimize overall management.